Hey there parents, welcome to our guide on nebulization for kids. Today we're diving into how nebulization can help your child breathe easier and feel better. First off, what is nebulization? You might have heard the term but wondered what it actually means. Think of it as a super effective way to deliver medication directly into your child's lungs, making it easier for them to breathe. It's especially helpful for kids with asthma, bronchitis, or other respiratory issues that make breathing difficult. The device turns liquid medicine into a fine mist that your child can inhale easily through a mask or mouthpiece, ensuring the medication reaches deep into the lungs. So why choose nebulization over other methods like inhalers or oral medications? One big reason is that it's easier for young kids who might struggle with inhalers, which require coordination and can be tricky to use correctly. With nebulization, there's no need to worry about coordinating breaths with a spray, which can be a challenge for little ones. Your child just breathes normally, and the nebulizer does the rest, making the process much simpler and stress-free. Now, let's talk about the process. It's pretty simple and straightforward. First, wash your hands thoroughly and gather all the necessary equipment: the nebulizer, mask or mouthpiece, and the prescribed medication. Pour the prescribed amount of medicine into the nebulizer cup, making sure to follow the dosage instructions carefully. Attach the mask or mouthpiece and connect the cup to the compressor, ensuring everything is securely in place. Turn it on, and in just a few minutes, the mist will start to flow, ready for your child to inhale. Encourage your child to sit still and breathe deeply, making the most of each breath to get the full benefit of the medication. The whole treatment usually takes about 10 to 15 minutes. Wondering about safety and hygiene? Always clean the nebulizer components after each use to prevent any risk of infection and ensure the device works properly. This involves washing the parts with warm, soapy water and letting them air dry completely before the next use. And remember, always follow your pediatrician's instructions regarding the type and dosage of medication to ensure your child's safety and health. What about side effects? They're generally mild but can include a slight cough or dry mouth. These are usually temporary and not a cause for concern. If you notice anything unusual or if the side effects persist, it's best to consult your doctor immediately for advice. Here's a pro tip: make the process fun and engaging for your child. This can help them stay calm and cooperative during the treatment. Let them watch their favorite show or read a book during the treatment to keep them entertained and distracted. Some parents even decorate the mask with stickers or use colorful masks to make it less intimidating and more appealing to kids. And hey, don't forget the importance of a calm environment. A relaxed setting can make a big difference in how your child responds to the treatment. Kids pick up on stress, so stay relaxed and reassuring. Your calm demeanor will help them feel more at ease. In conclusion, nebulization can be a game changer for managing your child's respiratory issues, providing effective relief and improving their quality of life. It's effective, relatively easy to use, and can greatly improve their quality of life. Thanks for tuning in. We hope you found this guide helpful. If you found this video helpful, give it a thumbs up and share it with other parents who might benefit from this information. Don't forget to subscribe for more tips on keeping your little ones healthy and happy. See you next time.